I'm really proud to announce that today we're gonna have Varshini Tamil Selvan, who's also one of our members for the club, and she's the webmaster, and she's an amazing member of our team. And she will present today on the topic of foreign body imaging. And it's a very exciting topic. We're gonna have lots of cases, lots of images, and if you have any questions or want to participate, you can go ahead and unmute your mic or raise your hand, and also we're gonna be on the lookout for that too, for anyone who wants to write stuff. Okay, and with that, I'll leave the floor for Varshini.
Thank you so much, Mariam, for your wonderful introduction. I really hope everybody enjoys the session today. Can everyone see my screen?
Yeah.
Yeah.
Okay, that's good. So just to make sure that everyone's more focused on the slides, I will switch off my camera, but just know that I'm still there. And if there's any questions, like Mariam said, please feel free to unmute yourself or use the chat, and I'll be looking at the chat box simultaneously. Is that okay? All right. So hello, everyone. I would like to firstly thank you all for joining this session today. Like Mariam introduced me, I am Varshini Tamil Selvan, a third-year medical student at the College of Medicine, MBRU. I am an aspiring pediatrician, and one of my special interests include radiology, hence that's why I'm presenting today. Today's presentation will be focused more on the pediatric population, and I hope you all enjoy. So by the end of today's discussion, we will be able to understand what foreign bodies in radiology are, understand who are more predisposed, see the complications caused in children, and we can recognize foreign bodies through case studies, as well as look at the summary. So what do you guys think are foreign bodies? Give it a try. You can use the chat box and you can unmute yourself as well. Can you guys see my next screen? Or is it still in one slide? Okay.
Okay, yeah, we see it now.
Okay, no worries. So what do you guys think are foreign bodies? Give it a try. Okay.
Hi, Varshini. I think foreign body is anything that's outside or not supposed to be inside the human body. So yeah, maybe something they've ingested, like something a child could have ingested, for example.
Yes, that's a brilliant answer. And thank you, Faiza, Fatma, and Noor for telling the right answer. So foreign bodies are actually something that is in the body, but it doesn't belong there. And they are normally not found in the normal human body. They can be inserted into the body accidentally or intentionally, like Hind said, and they can also sometimes be swallowed. They can become lodged or they can get stuck in various parts of the body, such as the ears, nose, eyes, and the airways. So I think there is a lag in the slides. Yes, okay. So can everyone see my slide?
Yeah, it's fine.
Okay. So foreign bodies, they are a common cause of emergency department visits. That's the fact that I would like to establish from the very beginning. And like I mentioned, they can also be ingested or inserted into body cavities, like in the peritoneal cavity. And they can also be introduced by trauma or through iatrogenic means. Some examples include paper clips, coins, water bottles, and some toxic ingestions like pills, etc. So foreign body ingestions or insertions, they are seen in 4 broad categories of patients. Number 1, children. mentally challenged adults or children, adults with unusual sexual behavior, and adults or children with predisposing factors or injurious situational problems. Now, this latter group, as you can see, I'm using my laser pointer. Can you see my pointer?
Yeah.
Okay, thank you. So this latter group includes individuals who may be abusing drugs or they engage in extreme sports activities like I've been showing you in this picture, or they may be subjected to abuse, whether it's child or spousal abuse. Mentally challenged adults or children, they are often repeat offenders and they will present multiple times in the emergency department for unusual injuries and foreign body insertions and ingestions. So, who do you think are more predisposed to have foreign bodies in their human bodies, for example? Do you think adults are predisposed, more predisposed? What do you guys think? Anyone? Yes, children are more predisposed. As you guys rightly said, children under the age of 4 mostly, with a slight male predominance, are more predisposed, as they are more prone to be very curious in nature and put whatever they grasp in their mouths or up their nose, etc. Typical examples include children swallowing coins, razor blades, and silverware. Even when I was a child, I had stuffed a miniature toy up my nose, and I have caused a lot of trouble to my parents. Yeah, that's a story for another day. So, as you can see in this x-ray here, a coin is seen in the stomach of a child. Okay? And fortunately, the vast majority of all swallowed objects, they pass through the GI system without a problem. However, we should be mindful that approximately 70% of children, they have witnessed to have had a choking event at the time of aspiration of a foreign body object. Children may otherwise present with cough, dyspnea, or irritability. What kind of complications can come by foreign bodies? Do you guys want to give it a try? You can use a chat box.
Suffocation?
Yes, suffocation. What else? Suffocation is a good answer. What other complications can occur in children? Think about it. You can imagine yourself trying to stuff something up your nose or swallow a toxic object, for example. So what do you think can cause, or what do you think can happen to the child? Okay, I think
Varshini, you
everyone.
can have an obstruction. You can have an obstruction in the GI tract, which will lead to like a lot of mucus, and then like maybe the baby's going to vomit.
Brilliant, Shekhar. Yes. So you can have esophageal or intestinal perforation, and you can have peritonitis. You can have abscess formation as well, and you can have generalized septicemia. And as I can see in the chat, yes, you can get infection, tissue damage, and you can get pneumonia as well. Exactly. Brilliant answers. So moving on to the interesting bit, it's time for the cases. And I will do a general head to toe approach. So you'll start with the head and we'll slowly progress downwards. Okay? Are you guys excited? Well, I am at least.
Yes.
So, thank you. So this is the first case. What do you guys think? What kind of scan is this? Is it a CT or an MRI? Try answering. Yes, this is an X-ray. So this X-ray, what do you guys think is the abnormality? What do you think is different in this X-ray? Is there anything additional or any difference?
There is something in the nose.
Yes, brilliant job. Yes. What do you think is on the nose? What object is it? Yes, it's a foreign body. But what is it? Is it a coin or a battery or a toy? Yes, this is
A battery?
Yes, this is a battery. So this is a scan, a X-ray scan, a frontal X-ray scan of a 2-year-old child a male child complaining of a sore nose. And the mother at the same time, she can't find her battery that she left on the counter. So she suspects that her son had put it in his nose, which is correct, by the way. And this is the lateral view of the same. You can see that the metallic foreign body is in a sagittal orientation within the posterior right nasal cavity. So most button or disc batteries, as in this case, they pass easily through the GI tract if it's ingested. But there is a risk of perforation in less than 1% of cases, or battery fracture, which is very deadly as it can cause heavy metal poisoning or perforation from their caustic content. Case clear?
Yep.
Yes, V. Yes.
Thank you so much. Do you guys have any questions with regards to this case? Okay, I'm going to take that as a no. Thank you so much for your activeness. Yes. Okay, so this is case 2. Let's go by how we normally look at the radiological scan. So is it an X-ray or an MRI? Is it a soft tissue radiograph or a skeleton radiograph? What is it? What do you guys think? This is an X-ray. Yes? Go ahead, answer. Okay, this is an X-ray. And what is abnormal here? What do you guys see that's not normally there?
There's a hook. I think
Yes.
it's in the esophagus. I'm not sure.
It's a hook and you are close. It's not in the esophagus, it's in the hypopharynx. So it's a soft tissue neck radiograph of a 1-year-old patient who has swallowed a hook and it's then the hypopharynx. All right. To the next case. What do you guys think? Is this a X-ray or an MRI? This is an X-ray, yes. Yes, it's an X-ray. What view is it? Is it a frontal view or a sagittal view? Yes, it's a frontal view. Which area do you think the abnormality is there? Which area do you think the foreign body is present? Yes, absolutely right. It's in the abdominal region. And this is a radiograph of an 18-month-old child. And this child has swallowed a large nail, but it passed through the GI tract without difficulty, although we should be mindful that it is a sharp object and it can cause like tears and bleeding. Yes, you're right, Rutvik. It's in the left hypochondrium. Okay, this is the next case. So what do you guys think? What scan is this? Yes, this is an X-ray. Brilliant job. And what view is it? Is it a coronal view or is it a sagittal view, a transverse view? This is coronal, absolutely correct. So what do you guys see that's different, that's weird in this scan? Do you guys see any abnormality in the scan?
Yep, there's a coin lodged.
Yes, there is a coin lodged. Do you know what the anatomical location of it? Yes, around the throat area, but is it in the trachea or in the esophagus? Where is it? You're asking the right question, Mariam. Absolutely correct. Unless and until we can see the lateral view, we cannot quite clearly know if it's in the trachea or esophagus. Okay,
I think some of the students from year 5 might be able to tell us if it's in the trachea or in the esophagus on the frontal view alone.
Really, Dr. Rania? Okay,
Yeah,
then.
I told you that. I told you that in June. Let's see who remembers.
Then you guys have
I
to.
told you how to tell on a frontal view if this is in the esophagus or in the trachea. So you can choose one of the year 5s.
I'm going to feel very guilty about this, but okay, Mariam, since you messaged this in the chat box, why don't you give it a try? It's okay. She's going to hate me now.
No, I don't remember actually.
Oh, okay.
Is it maybe? No, I'm not sure.
Actually, you don't have to worry about it because I will be covering that bit as well. You can see it in the frontal view as well, but then there is a slight clarity or there's a slight difference between them. But let's move forward with this case for now. So as you guys rightly said, it's a coin in the chest x-ray and it's over the upper thoracic spine. It's in his esophagus. And I will tell you how to identify whether it's in the esophagus or in the trachea. But this is the lateral view as highly demanded. Can you guys see the screen? Yep. Okay. So this is the lateral view and this is the coin. And now, Mariam, can you tell me if it's, I think I already revealed it, but you could maybe tell if it's in the esophagus or the trachea.
Yeah, we can see it now. It's like in the esophagus.
Exactly. It's in the cervical esophagus, lower cervical esophagus. And this is the next case. After this case, I will tell you how to identify whether the coin is in the trachea or in the esophagus. Okay, so stay tuned for that. But now let's come to this case. This is a different case. What do you guys think? What scan is this? Is it an X-ray or an? Yes, this is an X-ray. Yes, this is an X-ray. Very good. What do you guys think is abnormal? It's very huge, and even the arrow is pointing over there. So you guys can maybe give it a try, even though the answer is right there. What do you guys think is a foreign body here? Is it a coin or a battery? It looks like a bottle cap. You're not, I mean, you're not wrong. It can look like a bottle cap, but it's actually a battery. Yes, it's not a coin, and I'll tell you why. Because in batteries, you can see that it has a beveled shape. If I go to the next slide, you can see that there is like a bevel shape here. Let me just get my pen real quick. It's not a sphere. It's like this. Can you see my annotation? Can you see my annotation? So it's not quite like here. It has a bevel shape. And this bevel shape you can see only in batteries. And in coins, it's just a flat surface. There won't be any elevated surface. So that's the difference. And this is the closer view of the said battery in this case. Now, as I promised, you can see the difference of a coin that's lodged in the trachea versus a coin that's lodged in the esophagus. So in the esophagus, you can see that the coin is very round in appearance in the frontal view itself, as Dr. Rania said. And you can see that in the trachea, it's more linear. Even though it's the same coin, the difference in anatomical positions tells us that how the anatomical structure is structured differently and how there's a difference between a coin being lodged in esophagus versus the one being lodged in a trachea. But the one that's lodged in the trachea is more dangerous and more fatal than the one in the esophagus because it can go into the bronchi and can cause a lot of distress for the child and even for the adults. Is it clear, everyone?
Yes.
Thank you. So this is,
although this is not percent, just a minute, Varshini, this is very important. So whenever the coin is looking at us, like the bottom picture, this is a reassuring sign that this is probably in the esophagus, but we still need to listen to the lungs of the baby to make sure the air is going in. Because there's like, we don't have absolute medicine, right? You can still have a coin that is just looking at you, but it's somewhere. What's common is common. If the coin is looking, then this is most probably in the esophagus. If it's going sagittal orientation, if like the picture on the top, then this is most probably in the trachea. And the reason is because half of the trachea is soft. So whenever an object is going within the trachea, it kind of takes that anterior posterior orientation, because half of the trachea on the posterior part of the trachea is soft, right?
Yes,
And the
doctor.
anterior part has cartilage. So whenever something goes into trachea, physiologically, it will take that kind of sagittal orientation. While if it's in the esophagus, it's going to look at you. But that's never 100%, like everything else in medicine. And everything, if you search, you could find some odd cases where it's sagittal, but it's in the esophagus, or the other way around. So as a doctor in the ER, when you see that and you see that the coin is looking at you, first you're reassured, but you will still get your stethoscope and listen to the lungs. If the lungs are normal bilaterally, then you're reassured that this is probably in the esophagus. You're just going to, and if everything else is good and the baby is in a good condition, then you're just going to wait for it to pass. He is not, then you're going to probably, ask for help and call for getting it out. Yep.
Absolutely, doctor. Auscultation is key always. Make sure
Yep.
the lungs are fine, and then once you can hear like normal sound, then you can be reassured that it's in the esophagus. Absolutely correct.
Perfect. Thank you.
No, thank you, doctor. So this is case 6, and I would be amazed if you guys can find out what abnormality is there in this. It's a very tricky case. But first, tell me, what type of scan is this? Is it an X-ray or an MRI? Yes, this is an X-ray. Do you guys think this is a normal X-ray or is it abnormal? Very tricky. Yes, I agree with you. It took me a minute to find out where the abnormal body is. Not quite. The diaphragm is okay. Diaphragm is normal. Anybody? I think I need to tell the answer to this case. But when you guys find out, you guys are going to be really shocked. Okay? So this is an 18-month-old child. And yes, the child has inhaled a stone. You can't really see it in this frontal scan. It's very tricky, isn't it? So you can see that both lungs are well expanded and there is no focal collapse or consolidation. But there is a slight increased density over the left hilum, and that is this stone. So the child was playing in the front yard and all of a sudden goes under respiratory distress, and then this is what we find under the X-ray. So I have another image of the same case, but another X-ray, and you can see it clearly now where the stone is. Yes, can you see the stone, guys? You can see the stone, yes? Yes, absolutely. It's very tricky, isn't it? Yes, now it's more obvious. It's a radio-opaque stone, and that is there in the left hilum of the bronchus, as I said. Any questions so far? Does anyone have any questions? Is it clear? Okay, so I shall take that as a yes, everything's clear. Okay. This is the next case. So which area is the scan focusing on? Is it the chest or the abdomen or the head? Although highly unlikely, but yes, this is the abdomen region. Where do you see the foreign body? Is it in the right or in the left? Or is there even a foreign body? It's in the ascending colon. Yes, on the right side. Absolutely. It's in the right side. And what do you guys think? What foreign body object is this? What do you guys think this 2-year-old girl has swallowed? It can be a bracelet, but what does that bracelet consist of? Like, what is it made of? Like, what's the material of the foreign body? Yes, beads, marbles. Yes, you guys are close, but these are actually magnets. These are actually magnets. So the child has actually swallowed a magnetic bracelet, and it's up in her ascending colon. So here, this abdominal radiograph demonstrates multiple small ball-like metallic foreign bodies because it's a magnet, and they are apparently attached to each other. You can see they're all joined together, right, in one line. And this is the follow-up radiograph that was obtained in the very same child after 5 days, and it shows that the foreign body is again in the right lower quadrant region. And this, of course, raises concerns about impaction in the patient's terminal ileum. So impaction is basically when the stool starts to get more compressed and starts getting collected in one region, and it can cause a lot of problems in the bowel. And this is a CT scan that shows the same. Okay, so these magnets were actually removed, and a focal small bowel was contained, actually, and that caused perforation, and it was found in surgery, and it's because of the impaction, by the way. And you can see that these magnets, since they are like well close to each other, it actually was less concerning. It's actually concerning, but less concerning when you compare it to another situation where magnets are all over where like multiple magnets are there in different parts of the bowel. And I really want to know if there's anyone who watches Grey's Anatomy. Reveal yourselves. Does anyone watch Grey's Anatomy? If not, don't worry about it. But if you do, it'll be more great. Anyone? Okay, so no problem, because I hope this case makes you watch it. So in Grey's Anatomy, there's a patient in season 4. His name is Brian. He actually, at the beginning of the episode, they show that he had swallowed the parents thought he swallowed 8 marbles, but it was actually magnets, and it caused a lot, and one of them actually caused a perforation in his bowel, and the magnets were still moving inside of him, so it was causing a lot of distress and bleeding. He had to be rushed into surgery, and the magnets were removed. That's what happens if there are multiple single magnets in different parts of the bowel. Any questions so far? Is everything clear?
Can you explain how does the perforation happen because of the magnet?
So the magnets, if there are multiple magnets in different parts of the colon, they can either attract or repel each other. So if they start to attract each other, then it can sometimes go through the mucosa and maybe rupture the arteries and the vessels that are there in the bowel, and it can also lead to volvulus formation and obstructions in the bowel because of the multiple magnets that are present there.
Yeah.
Yeah. Thank you so much.
Perfect.
Yes, thank
It is the magnet one, right? It can just pass, and we don't have any hazards. Not like the one magnet can just pass normally, like any coin, and because it's rounded, it's not going to cause any obstruction or anything. But when it's multiple magnets, then they can orient themselves in a funny position. There are some pictures in the literature showing them going in a bracelet, in a circle. So you can imagine if one of them is in the stomach and one of them, or in the small bowel, and one of them is in the large bowel, and they suddenly attract each other. they can go through the bowel wall and cause either perforation or ischemia.
Absolutely. And please feel free to maybe after my session, Google for all sorts of scans and cases of foreign bodies. You'll be very amazed. Like I had a hard time picking through which case to pick and which case to show you guys because it's really interesting. So moving on to the next case, what do you guys think is wrong with this scan? Oh, okay. First, let's start with where exactly is this scan focusing on? Is it on the chest or in the abdomen or in the head, neck? Where exactly in the body is this scan focusing on? Anyone? Abdomen, absolutely correct. What in the abdomen is being affected here? Where the foreign body is in this abdomen? Okay, what organs does the abdomen have? I need to go very simple with my questions. Yes, absolutely correct. It's the colon. Which part of the colon do you guys want to give it a try? Which part of the colon is? One of them is a sigmoid colon. Which other part of the colon is affected? Sigmoid is correct. Sigmoid, along with sigmoid, which part is? Absolutely. Bingo. The rectum and the sigmoid colon is affected. This is a scan of a 5-year-old child who was admitted in the emergency department with complaints of abdominal pain and constipation. So when the physicians did an abdominal examination, it revealed a hard, palpable lump in the left iliac fossa, exactly where the sigmoid and the rectum is located. And you can see that the X-ray has shown, the X-ray of the abdomen in the standing position has shown rectum and sigmoid colon pack. So this is called foreign body packing. And it can be, and in this case, it was introduced by a second person during sexual abuse. So so you guys might think, what is this substance? What is this foreign body consisting of? It's actually multiple small calculi, and it was introduced by another person into the rectum of this child. So before I start the next case, is everything clear so far? Any questions you guys have for me? So I'm just going to take your silence as a yes, and I'm going to move on to the next case. So again, you know our drill. We've been doing this for the past half an hour or so. So what type of scan is this? Is it an X-ray or an MRI or a CT? Anyone? Absolutely correct. This is the X-ray. Which part of the human body is this X-ray focusing on? Abdomen region, and there's another region which the lateral view is showing. So the frontal view is showing abdomen, the abdominal region. Yes, brilliant job, brilliant job. It's the abdominal pelvic region in the lateral view. And where do you guys see the foreign body? Is it here? Is it here? I don't think so. Is it this? Yes, absolutely correct. It is near the pubic symphysis. Thank you so much. Yes. So this is a plain X-ray of the abdomen and the pelvis, AP and lateral view of a 2.5-year-old female child. She had a lithium battery. She had stuffed it up her vagina, and a vaginoscopy was performed and the battery was retrieved. However, the battery has corroded. Oh my God, it has been corroded and it caused vaginal ulceration. So they had to do further actions and they had to make sure the child was fine. We must be aware that these lithium batteries can be very hazardous and it can actually cause significant damage in a short period of time. So The last but definitely not the least case. Can you guys see my screen? Okay,
Yes.
thank you. Thank you. So, well, what do you guys think is happening in this X-ray? No, it's not the wrist actually. You're close, but it's not the wrist. The wrist is perfectly fine. What do you guys think? Wow. Yes, the third metacarpal. Absolutely. You guys are geniuses. Wow. Okay, so this, what do you got? So if someone sees this without a proper history or without knowing what it actually is or how this person got this in their third metacarpal, they might think it's a overgrowth of a bone or some sort of something along those lines. But it's actually a glass. And you can see in the Indian community, you can have a lot of glass bangles. So this is a 7-year-old child, a female child. She must have been wearing one of these glass bangles, and glass, they break, right? So one of them broke and it went through her third metacarpal. And so basically what you have to take away from this slide is that this is called the extremity foreign body. And it's quite uncommon with regards to the other types of foreign bodies in other types of regions that we've covered just now, like with regards to the chest or the abdomen or the head or the neck. This is quite uncommon. It's very uncommon to see foreign bodies in extremities, like in this palm.
We got a lot of them in my clinic last month. Do you know why?
Oh, okay.
A lot of glass foreign bodies from certain nationality. Do you know what that nationality is?
Which one?
Lebanon.
That's very interesting.
We had so many because of people who were on vacation during the explosion in Beirut. A lot of people actually came back to Dubai and came to us with zillions of small glass pieces everywhere in their body. Of course, that's not intentionally done. It's just because of the explosion that broke every single glass in Beirut. And there was a small, innumerous number of glass everywhere, and also people who fled, tried to just run away. Many of them were barefooted. It was summer, and they were running over glass because the glass was everywhere in every street and every floor. So they were running over glass, and we had a lot of patients coming to I only saw them when they came to radiology, but in the ER, they saw so many of them with their feet full of. Not all of them are radiopaque. It will depend if the glass is leaded or not.
Yes.
But by ultrasound, we can see them sometimes. It depends on the composition of the glass, obviously. So basically, if your glass is having some metals or anything with a high atomic number, then we're more likely to see them. So in foreign bodies, sometimes if we can't see it by X-ray, you can try by ultrasound. If not by ultrasound, can try with MRI. But it's quite a difficult thing to see. With MRI for the year 5 students, does anyone know what's the best sequence? Or Muhannad, maybe you did your research on MRI. What's the best sequence to see foreign bodies? It's the same sequence that you use.
Is he on this call? Let me see.
I'm not sure.
Yeah.
Anyone who knows that there's a sequence where you can see foreign bodies or hemosiderine or anything that is not supposed to be there. It's gradient echo. Gradient echo can see metal clips or any subtle foreign bodies. Of course, if the foreign body is big, like someone with, I'm sure you've seen MRIs of the brain of people with braces, for example, or dental work, you have a lot of artifact. The MRI is not going to be good. But if we're talking about something very, very tiny, then you could see it on gradient. We're talking about very microscopic, tiny foreign bodies. But sometimes we exploit all modalities. We try to look for the foreign body with all different modalities until we find it.
Yes, absolutely.
And sometimes we don't see it at all with any imaging modality.
It's quite a devastating case what happened in Beirut.
It is.
Yeah.
Yeah.
So with that, we are finished with our cases. So let me summarize my presentation. Foreign bodies, we are basically very common cause of emergency department visits. Young children are the most predisposed patients. Complications can include esophageal or intestinal perforation or obstruction, peritonitis, mediastinitis, abscess formation, or generalized septicemia. And lastly, like Dr. Rania said, all patients should be thoroughly screened for foreign bodies before they undergo an MRI study. So these are the list of sources which I have referred from to make this presentation. And I would like to thank you all, as well as Dr. Rania and the MBI Radiology Club team for making this session an amazing one. And thank you so much for attending. If you have any questions, feel free to unmute yourself, or you could type it in the chat box. If you want to contact me, here's my email address, and that's my Instagram handle, and you can contact me on Twitter as well. Do follow Radiology Club, MBI Radiology Club on Instagram, Twitter, and please subscribe to our YouTube channel. Thank you so much and have a lovely day.
Varshini, if you have, sorry.
Yes, doctor. Oh,
you have some glass in the nose. What would you think about in an adult?
Sorry, doctor, could you go again?
If you are doing a CT scan for another reason and you find little pieces of glass in the nose, in the nose of the patient, what would you think about?
Maybe it can be from a fight. So someone may have involved glass bottles and they might have tried to attack the other person. Maybe that can be one. Or it can be from bombs.
Let's say the patient denies any history of trauma or any fight or anything, and you just found some glass specifically in the septum, in the nasal septum, in the middle of the nose. And he doesn't have any earrings or any of those things. Just small particles of glass, very, very tiny particles of glass inside his nose.
Is it possible to be substance abuse?
Yep.
With
exactly.
glass mixed with it? Okay.
Yes, certainly. And it will be also associated with damage of the septum.
Yes.
So it's good to know because that can explain, for example, atrophy in the brain or other changes in the brain that you're seeing on the CT scan, or can explain his loss of consciousness that is not related to any other medical reason.
Yeah. Yes, doctor. It's a very interesting case you brought up. Thank you so much. And thank you so much for attending, everyone. And thank you for being a very active batch. And I'm looking forward to see you all in future Radiology Club events. So please feel free to fill in our feedback form and let us know your comments. I hope you guys enjoyed today. Thank you.
Varshini?
Yes, Noor.
I don't have a question, but I have something to say. First of all, I just want to say that it makes me so proud to be part of MBRU when I see students in third year being able to give such sessions. Personally, I'm a third year, but I don't think I would have been able to deliver this session in the same way you did. What I like the most is the fact that you kept us engaged the whole time by asking us questions on even the smallest things. And your tone of voice demonstrated how enthusiastic you are about medicine. So good luck in your career, Varshini. We are so proud of you.
Thank you so much, Noor. And I'm pretty sure you would do a better job than me, trust me.
No, I don't think so.
Oh man, you should have some faith in yourself. I'm sure you will do a better job than me. You had a question, isn't it?
No, I didn't have a question. I just wanted to actually tell you that thing.
Okay, bless you, Noor. Thank you so much. Thank you so much, everyone, for coming. And I'm really glad that everyone can benefit from my session today. Take care and have a good day.